Okay, so now I'm going to describe the sleeve gastrectomy. So what is this surgery? What is a sleeve? Is something put in? And that's kind of a misnomer. I'm not exactly sure why they called it the sleeve gastrectomy, but we're not putting anything in. What we're doing is turning the stomach into a long skinny tube, and we do that by taking a stapling device and we go all the way up and we actually remove this big portion of the stomach. It can be around 60 to 70% of someone's stomach. Now, what does this do? It does two things. Number one, it decreases how much food you eat before you feel full. So food comes down, hits the stomach, it's smaller, sends a signal back to your brain that you're full, you stop eating. The other thing it does, and it's a temporary effect, but it does decrease the amount of ghrelin that's produced, and that's a hormone that makes you feel hungry. Now all of a sudden, it's way down. It does come back. There are other hormones that are at play in this surgery. And we also see that ghrelin goes down in the other surgeries as well, like the duodenal switch and the gastric bypass. So one thing here is that you'll see there's no rerouting. So for people that have extensive abdominal surgery with lots of scar tissue, this is a good surgery because we only have to work up here. Or if a lower BMI female without all the joint pain and problems that just needs to lose a little bit of weight, this is also a very good surgery. It can potentially stretch out, so you do have to listen because it's such a big stomach, or so much of a bigger stomach than the gastric bypass, can potentially stretch out. So watching what you eat and listening to your stomach is very important. This should also be known, this is kind of the first step towards a duodenal switch, and this is where the sleeve gastrectomy came from, was the duodenal switch.